Yes, I think there's one question regarding this. What considered as a high mortality? What is the percent mortality?
Yeah, and
Yes, and
how I
has
think
it.
that this is also related with the how we related
Uh-huh.
with the biosecurity.
Yeah. I I think this is also in touching upon this the concept of baseline mortality. Because they are if the the farm has known their baseline mortality, so what actually exceeds the normal level, this should be considered as not normal. And then, but in our study, we didn't specify the percent mortality, and it was actually up to farmer perception of what they think is exceeding their level of baseline for their farms. And yeah, they could be, because this farm is coming from a different region, different country, they could have been different level of the baseline mortality. But if we compare with the, sorry, if I was thinking that if we compare with the some very harmonious way of the management like in Norway, so that could be a way of putting the level of baseline mortality and with the certain confidence interval among it.
Yeah, but
But if, yeah,
in anyway, I think
yeah,
that you found
yeah,
some correlations between
yeah.
biosecurity and outbreaks, no? That was some of the questions we did it, no?
Uh,
Am I right?
for the, yes, there are, yes, there, but there's, this is another, we said, but it's not the question, I guess. This is the other question on that as well, or what?
I'm not sure. I think that it was related, or at least I was trying to clarify that when you refer to correlation between in the biosecurity measures between biosecurity and mortality, in fact, the
Yeah.
correlation was with outbreaks.
Yes, there are there. Yeah, we found some of the factors have significant associated with the what consider high mortality based on the farmer perceptions on the farm. Yeah.
Okay.
Yeah.
Just to insist
Yeah.
on the
Yeah.
conclusions that you were presenting, no, is that
Yeah.
this tool is not only a tool for scoring, it's also like a very nice audit, no, that the farmers can do in order to continuously improve, no?
Yes, exactly. Well, we expect that this could be applied or could be used for those who interested to 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 get the measurable level of their biosecurities. Mhm. So then there could be a way to see what are their current status and have more instead of subjective in knowledge. So we have the measurable level that could be checked whether or not there are where they are this year compared to next year, or maybe where they are comparing to other neighboring farms.
Yeah.
It's like a
Um,
benchmarking. Yeah.
and it's a very good way to show that there are room for
Mm-hmm.
improvements, no? Because in the results you have shown, they are the average, but also you
Mm-hmm.
have shown that there are big differences, no, between farms, and that means that many
Mm-hmm.
farms have room for improvements, right?
Yes, there always room for improvement, of course. Yeah.
Mhm. Okay.
Yeah.
I don't know,
Yes.
Edgar, would you like to add
Yeah.
something about this discussion?
No, I just saying that having such a system is also a way to identify where you have gaps, and you can tailor your resources more strategically into those areas where you see most needed. So that is one additional way to think of it. When it comes to this mortality, what is the level of acceptable mortality? I think that's something we all need to work on. What would be acceptable in a production, and that will vary, I guess, between phases and stages in production, and maybe also between various animals, but I think it's definitely something that needs to be worked on and to have a acceptable level of mortality in aquaculture production. The way it is now, I feel it's far too high anyway. So that's an ethical also questions related to these things.
Yeah.
Yeah.
And mortality is also related, it's a transversal issue that is related with everything in health management, no? For example, Anna Rocky was discussing a little bit about this as indicator in welfare. eh? Without knowing what is the baseline mortality, is very difficult mm, eh, to understand better what can be a high mortality rate. But anyway, for the
Can I
farms,
say something about mortalities?
yes,
I
please.
think you need to. I think you need to. I mean, apart from what you, if you have many mortality peaks throughout the cycle, even if it's like not very, not a huge percentage of fish to your cumulative mortality, that's not a good situation health-wise. You know, if you find out you have 2 or 3 mortality peaks that are unexplained, that immediately puts you into a bad situation, even if you don't really know or never recorded what would be your expected baseline mortality. I think you know, like Edgar was always like insisting on this, what's the normal mortality for such and such system or a farm, and you always say, oh, you know, you need to wait a few years. And then, but I think it's also important that if there's peaks of mortality, that immediately, if you don't know why they're there, that's just bad health.
Yeah. There is something in relation with mortality and biosecurity, is that even if we have difficulties to know about what is the baseline mortality in the sector, or what are the average mortality in the sector, or what are the average biosecurity measures in the sector, as Saraya pointed out, a farmer can always check with himself year after year in order to look for improvements. And for that, we need methodology. It's very important to record the mortality and the causes of mortality in order to know that we are improving. My answer to Edgar is about what is an acceptable mortality rate. I would say that it has to be lower than the years before. At least to try. I mean, you have to show that you are trying to improve. Eh?
And
You
just
can
to
always
add,
compare with yourself, no?
yeah.
Saraya?
Yeah, I just want to add a little bit to this, the tools that we use. I think it's more like a systematic way to look at how you practice your biosecurity, and then put it in the way that you can actually categorize into, because we show that there's external biosecurity and internal biosecurity. For external biosecurity, we have several subcategory that relevant to what are the practice that actually prevent introduction of diseases into the farm. And within each of subcategory, you have a specific question that contained in each of the subcategory. And then by running through this exercise, you actually be able to pinpoint into each of the detail. First, which is the external, and each within subcategory within the external biosecurity, and what question that actually you should looking into to improve. And so that is another way, is of course as a benchmark, and also a way to help farmer allocate their resources to what actually they should put their resource into.
Good.
Yeah.
Well, I'm sure that we can continue
Yeah.
with this, but time is running, and there were, I think, some questions for Anna. I don't know, Anna, if...
Yes. Yes, I'm
You have
here.
seen those questions that were addressed to you about,
Yes.
for example, the non-lethal method for control of vertical transmission in spawners.
Yes, I would like first to ask a clarification. Do they mean organizing a proficiency test for ELISA, or if this method, the ELISA, is in place and is useful? Because I don't understand the aim of the question. However, the ELISA for detecting antibodies in CBUS is a method in use, and is one of the methods that we can use to check, to screen the broodstock in order to select free broodstock in a hatchery. As far as I know, not so many laboratories have this ELISA in place. We do in mine. We pass the methods to DTU, so to Sophie, and she tests in her experiment and work pretty well. So I think it's a good method. We have to disseminate and to distribute, and then in the future we can also think about organizing a proficiency test on this. I don't know if I answered the question because it was not clear to me.
So. And there was a question about the laboratories that have participated in the.
Yeah, unfortunately, the answer is no.
But may I say that most of the national reference laboratories have participated?
Yes, and all the laboratory partner of the Medade and the Perform Fish, so the other project, took part to the exercise. So,
okay.
So
you are not disclosing the information, but not difficult to know who has participated.
And also, perhaps we should say that Medade has produced a mapping of diagnostic capacities, which is in one of our deliverables and in the manual. So you can, obviously not who participate in this exercise. This is confidential. But if you want to see the diagnostic capacity, then you can consult that document.
Yeah, right.
Okay, there were, I don't know, I'm sorry because we are running out of time and there are many questions, but let's continue. I would like to give the chance to Sophie to address to some of the questions that you have been made.
Yes, I answered, I think, all of them in writing, but if you want me to highlight some, I can do that.
Yes.
Well, the first one, no, not the first one, but the one that I have in front of me here is if I think there is a possibility of having resistance over time to the vaccine. And I don't know, but I suspect that this arises from the debate that there is right now with the corona vaccines, if the vaccine will protect different strains. And as far as we know now with the Noda nevus necrosis virus, the IgNNV, which is causing problems with the CBAS, they are all within the same serotype. So that means that they have the same surface molecules. So a vaccine developed on one of these should protect against the others. And usually we don't see a big antigenic drift, as it is called, in these veterinary pathogens in the same way as in the human corona, because right now corona is infecting many people and all over, so there's a big chance of mutations happening and spreading. But in this very constant disease situation, it's not likely, I would say. But if it happened, then actually the VLP platform is fairly easy to change the recipe and then produce another strain. Of course, it should be tested again, but it can be done if that happens. So that is an advantage of this platform. Should I have another one? Yeah, there was also a good one here with, or at least a very practical one. How long does it take for the vaccine to show effect? And I didn't specify that, but I know that Anatofan in one of their experiments detected antibodies already after 14 days at 20 degrees. So around less than 300-degree days. And we have performed a challenge 1 month after vaccination, and the fish were very, very well protected in the experimental challenge at that time point. So we expect somewhere between 2 weeks and 4 weeks. That's where the fish would be protected.
Mm-hmm. Okay, thank you. I don't know, Dolores, would you like to address something?
Yes. Well, one asked me about availability of information about the new commercial vaccine, and I can say that I don't know if there's any information except from what the producers have in their leaflet. To my knowledge, there's no testing, no independent testing of them. Then there is many asks about the volume of the dose, and we tested 50 microliters, and as far as I've discussed with the ones that are producing it, they expect that they can obtain these 40 microgram in the volume of 50 microliters. So I think that's what they aim at, going for a dose of 50, a volume of 50 microliters with somewhere between 20 and 40 micrograms in. But of course, this will depend if they can obtain this concentration in the final product, or how they package it. And there's a lot of practical stuff in that too. So I don't know yet. It will be decided later.
Mm-hmm.
Yes, I would like to make a comment, Bernardo, if I may, to use just for a very quick one. It's just a point which goes back to Edgar's introduction about the need of communication and transparency when we talk about health in general in all issues, but with health. And I think today's presentation in the different aspects have really demonstrated that unless we have that, producing wonderful, sophisticated tools will be limited, will have a limited impact. It will have an impact internally at the farms, of course. But we've seen in Saraya's presentation quite clearly biosecurity, the external component. It depends completely in aquaculture zoning, in governance, and in proper good information about what is going on. I mean, you can benchmark your facility, vaccinate your fish, and keep them in a very good, extremely good welfare status. But if you have a farm 1 kilometer away from yours, and that happens, if you have a farm with no quarantine protocols even, then therefore you are jeopardized by that. So it is a collective issue. We know that very well with the coronavirus. We have all experience. It is not just a farmer's issue. Therefore, the external matters of health and are going to, in my opinion, condition the progress of aquaculture unless we really take that into stakeholders which are, dealing with administration and the communication among the producers.
Yeah.
Sorry, it perhaps sounds very political, but I really believe that unless we achieve that, we are going to be compromised.
Yeah. Well, just to close, I'm reading a last comment that Edgar has written in the chat, and I want to add something on that about what we can accept or what we cannot. Well, just to say that in aquaculture, you know that we have concentrated in the growth of fish, in the feed conversion rate, in the efficiency, in having fish bigger, and we have estimated economic benefits of that. However, we are yet not able to evaluate the impact of the diseases and the pros and cons of biosecurity, vaccination, and other measures. And this is something that we need to advance a lot. And for that, we need to get data, analyze data, share data. Otherwise, it's going to be difficult. Otherwise, we will be able to advance individually, but not collectively. So this is a call for cooperation to all the sector. And the question what has been said before, well, how much, what mortality we accept as acceptable ethically, that now we are talking about welfare and ethics. Anna Roque said, okay, besides the cumulative mortality, we cannot have these peaks of mortality. We cannot have that in the fish. And how much can we accept? At 30%, as many farms they have it today in the Mediterranean, 20%, as many farms, and this is almost the average of mortality that we have in the Mediterranean, or just 5 or 10. We don't know the numbers, but my advice or my concept is that we can only accept improvements. Improvements is what we need. And we need to see how farmers are improving in this and fighting to decrease mortality rates and fighting to improve welfare. I think that is the message for everybody. And that is the only thing that we can accept. I don't know, Edgar is smiling about this, but
I could just add, I think this is a nice way of ending this, because we are producing, or we are using animals to produce food, and we need to respect that. And also to compare a little bit with we try to change attitude in Norway as well. We are talking always about losses and biomass in aquaculture. But after all, we have so many tons of biomass, but this biomass is composed of individual fish. So we try to talk about how many deaths are there, instead of saying that we lost 1,000 kilo on this site. We're talking about we are losing, let's say, 500 fish, individual fish. And also this attitude of how we talk about fish is important, because we do that in cattle and sheep, and we need to sort of transfer this into aquaculture as well, because we are talking about individual animals. And if we start thinking of them as animals, we change and we treat them differently. And then we can think of, let's say, Norway, we have every year we lose 50 million fish. We started talking about the number instead of of biomass, and that has changed the attitude quite a lot.
Mm-hmm. Good. Okay, I'm sorry, but we need to close the webinar. We are going.
Let me, Bernardo, before
yes,
we go,
you want to say something? Yes.
Bernardo, just let me say thank you to all participants. I think we have been able to, you have helped us to show what Medate has achieved in these 3 years. I think we can be very pleased with the work done. And thank you for all participants. We had 70 followers, so that's been excellent. So we are very pleased with that. Thank you to all of you to join us today.
Yeah, okay. We have opened yes, a 2 questions poll for those of you that, just to know, you have used the language interpretation system that we are providing. Very quickly, just say yes or not. If you have used it, please tell us which language you have followed. And just to finish, this webinar has been recorded. And the videos will be uploaded in the same page that we were informing about the webinar. And we are doing the same with the other webinars, with the previous webinars from World Package 3 and 2, and we will continue in that way. So in case that you have missed something, or you know about a colleague that has missed something, just I'm inviting you to visit our webpage, look, see the webinars, and go to the deliverables publication section, where we are making available all the information that the project is producing. Nothing more, just to thank all the panelists for being here today and all the participants.